In this video, I'm going to show you a series of simple exercises that you can do at home that can quickly relieve your neck pain. The best part is they only take around 2 to 3 minutes to do, so you can get really fast results. Now, before I show you the exercises, I do want to say that pain can be fairly complex and there can be different underlying causes in different people. So what I'm about to show you is normally very, very effective, but sometimes to keep the pain away, there are other things that you might need to have to do. So at the end of the video, I'm going to explain what they are. We're going to start with some mobilizations for the joints in your neck. And when you do this, you want to try and maintain as optimal a posture as possible. So what we don't want is the pelvis tilting forward and the back arched. We want to have a neutral pelvis, and we're then going to lengthen the spine and imagine something that's pulling us up from the top of our head. So we're going to try and maintain that as we do the different exercises. We're going to start with rotations. So you're just going to rotate your head from right to left. And you're going to do this between 5 and 10 times. And it's really important that when you do this, you don't move into an area that causes pain, because you don't want to teach your brain to move into painful ranges. So you're going to use the maximum range that you can without pain. So maybe I can only go to here, and that's completely fine. That's what you'll start with. Over time, the ranges will start to increase. So after that, we're then going to move to lateral head tilts. So I'm tilting my head from side to side. Again, I'm creating length as I do it. So I'm imagining I'm being pulled up through the crown. And then I'm tilting to the right and I'm tilting to the left. And again, 5 to 10 reps is going to be a good target. Ideally keeping the rest of your spine still and keeping your shoulders still as you do this. After that, we're going to go forwards and backwards. So I'm just going to bend my head forwards and then tilt my head back. And the same rules apply. We're just going to do the range of motion, the maximum range that we can, without pain. So if it hurts when you go into a certain position, just reduce the range of motion. From there, we're going to go to a forwards and backwards head glide. So I'm imagining gliding my chin forwards and then tucking my chin. And as I do this, when I come back, I should feel a little gentle stretch at the back of my neck, just here. And as I go forwards, I want to keep my chin down. So what I don't want is this sort of thing. So we're not trying to do this. We're trying to keep the chin down as we do it. Next, we're going to go for some lateral head glides. And these can be really challenging for people, but it's an important exercise to work on because it's a movement your neck should be able to do. So the way that you're going to set up for this is you're going to give yourself a target. We're going to be gliding the head from side to side, but I want you to give yourself a target. So maybe 1/2 inch or 1 centimeter away. So I'm touching my cheekbone, touching my head in this position, and then I'm just going to move away a really small amount. And that's going to give my brain a target to try and glide towards. Now this might take a little bit of practice, but hopefully with practice you can get this movement to happen, because it's a really important function that your neck should be able to do. Next, we're going to try and combine those last two movements into a circular glide. So this is now adding a coordination component, which is really important for actually keeping pain away long term. And we're going to talk about that more in a moment, but sometimes when your brain isn't good at coordinating a part of the body, that can be an underlying cause of pain. So you're going to try circular head glides as the final mobilization. The next thing we're going to do is mobilize the accessory nerve. So this is the nerve that supplies the upper trap muscles and this big muscle, the SCM on the front. And often these muscles can get really tight in people. And one of the underlying reasons for that is sometimes because the nerve isn't moving as freely as it should. So we're going to mobilize it. Very simple exercise, but it can be very effective. Now, when we're mobilizing a nerve, we just want a small amount of tension. So we're not trying to get a really big stretch. We're just trying to get a 3 out of 10 in terms of the level of tension we feel. So I'm going to start on my left side first. The way that I'm going to do it is I'm going to pull my shoulder blade down and pull my shoulder blade back. I'm going to hold it in that position. I'm then going to lengthen through my neck, tuck my chin, tilt my head away. And in this position, I've actually got a little bit of tension in this nerve, so we should feel kind of a deep stretch in there. But then what I'm going to do is I'm going to kind of glide my head forwards and tilt it away. And as I go into that position, then I can feel that tugging motion into the nerve. I'm going to go for around 5 to 10 repetitions on that, and then I'm going to switch sides and do the same thing on the other side. So I pull my shoulder blade down, pull my shoulder blade back, tuck my chin, tilt my head to the side, and then kind of bend it forwards and move it away. And you might have to play around with a position, because Different people respond slightly to different things. So for me, down, back, tuck the chin, tilt away, and I like to turn my head a little bit in that direction. That works really well for me. For some people, gliding the head forwards in that position gives them a stretch. But for me, when I do that, I get a good mobilization into the accessory nerve. The next thing we're going to do is a contraction exercise for the upper trap muscle. So this is a muscle that often becomes tight in people, and I find that when people stretch it, it feels better initially, but the tightness normally comes back. It's actually a more effective strategy to work on contracting the muscle, because then the brain starts to relax it a little bit more naturally. Now we've just mobilized the accessory nerve, which supplies this muscle, so that's going to help to switch things on. Now we're going to contract it. And the way that we're going to do this, I'm going to pull my shoulder up and back, and you might already feel tightness in this muscle as you do that, but now I'm going to tilt my head back, tilt it towards the side that I'm working on, and turn it away. And when I get into that position, I get quite a strong contraction in this muscle, and it might feel like it wants to cramp, but then when you relax it, it should feel pretty nice. And then I'm going to go to the other side and do the same thing. I'm going to pull my shoulder blade up, I'm going to take it back, I'm going to tilt my head back, tilt my head towards the side that I'm contracting, and then turn my head away. And as soon as I start to do that, I get a nice, strong contraction into this muscle. And I'm not trying to squeeze it as hard as I can. I'm just getting a moderate contraction. And then I'm going to go back, and I'm going to do the same thing on the right side. So shoulder blade up and back. So shoulder blade up and back. Tilt my head back. Tilt it towards the side I'm working on. Turn it away, just hold for a few seconds and then shake it out. And then I'm going to do one final time on my left side. So shoulder blade up, shoulder blade back, tilt my head back, tilt it towards and rotate away. And then shake it out. So we've done 3 different types of exercise. We have done joint mobilizations, we've done a nerve mobilization, and then we've done a contraction exercise. And hopefully, as you go through those, you're going to get some nice relief. If you do, it'd be awesome if you could leave me a comment to let me know and give me a thumbs up. And obviously, if you haven't subscribed to my channel before, it always really helps me out if you could do that as well. Now, for best possible results, you want to work on these exercises maybe 3 or 4 times a day. Once you know what you're doing, it only takes 2 to 3 minutes to do them, but that can be a very powerful combination for people that can help to permanently keep pain away, because by doing it several times per day, we're going to start to retrain and rewire the brain. But if that doesn't work for you, if you try it several times per day and it doesn't fully get rid of all your problems, I want you to know that's okay, because potentially there are other things going on that you might need to work on to keep your pain away. That was exactly the situation for me. I had chronic pain for most of my younger life, and this type of training worked well for me, but it didn't fully solve the problem because I had some other issues that I had to deal with. So if that's something that you would like help with, I've got a program where I help people to address all the underlying causes of pain, and I'll leave a link to that down in the description so that you can learn more about it if you're interested. If you want to check out another YouTube video right now, I've made a video that goes into a little bit more detail about one of the common underlying causes, something that was really important that I had to address to get rid of my neck pain.